start of the week with a day of celebration. So on Friday, it's the NSPCC Childhood Day. So I'm sure that we'll be marking that, Ed, with some comms on Friday from across the Children's Hospital. So as normal, if you've got any questions or comments, just please pop them in the chat. Hello, Colin.
Hello,
I'll just finish this spiel and then I'll hand over to you. So you just put your questions and comments in the chat as normal, and we will record the session so that you can watch it later or share it with your colleagues. So I will pass over to Colin now for some key messages.
So thank you, Lauren. Apologies for my tardiness this morning. So I hope you've all had a good Jubilee celebrations over the weekend, and well, over the extended bank holiday weekend as well. The bits that we need to remember today, anyway, on Friday this week, is the NSPCC Childhood Day, and the real sort of highlight and focus on safeguarding and looking after the children that we meet, as well as making sure that they are safe. There's still a huge issue around it, so please beware of that on Friday and highlight it to the rest of the teams around you. But the news across the trust is obviously good from the point of view of things COVID related, and the fact that our numbers are going down, and that is allowing us to address our backlog. And certainly that's specific within the Children's Hospital, that we have a plan in place for all our 104-week waiters. That's people waiting 2 years, which is such a long time, but there's plans in place to get through all that, which is great. Some of that you will have seen in line with our Imagine project as well, that we've got going through our HDU. So please engage with that, and obviously if people are wanting to come forward and work for shifts, then we'll work with you around it. We did manage to trust managed to complete 2,654 elective operations, and that's over 500 more than we did in April. So it is the decrease in numbers in COVID are helping us with achieve our backlog and get through it, which is great. Some of you will also have noticed the concern around contrast that we had around CT over the weekend, and I think that will be ongoing, so be aware of it if you are requesting CTs, or as part of your practice is such the case that contrast is required. Please be aware that there is a national shortage of it, but we're working to secure for the most urgent of scans contrast to allow them to be processed. The other aspects I want to pick up on was the healthcare infections and associated infections that we have. Obviously, if COVID numbers have decreased, highlight on other infections that can still happen, and there's still obviously still reminder for all of our teams to continue with their excellent hand decontamination before and after patient contact, so let alone going into a different clinical area, but actually before and after every patient contact. For devices to be also cleaned as well as isolating patients who have suspected infections, and hand hygiene as well for patients, obviously, as they go through our services. There is also the Rainbow Badge programme, which is now on to phase 2 in 2021. This was commissioned as a collaboration to provide a system for assessment model, basically, and LTHT was successful in applying to be assessed as a first cohort to ensure that we were fair and inclusive for all our LGBT plus staff and patients. And as trust, we were given a grading, will be given a grading of foundation, bronze, silver, or gold. So please do get involved. It's obviously great to have Paul as the lead for that within the services based within the Children's Hospital. But in the Children's Hospital, we would want to definitely, yeah, here's the link for the survey. Thank you, Paul. Please do the survey. That will allow us to get the feedback that we need to allow our services to improve. So with that in mind, I will hand you back to Laura to discuss what happened at Bronze. So that's our operational sort of updates of happening specifically within the Children's Hospital. Laura, back to you.
Thanks, Colin. So we didn't have our Bronze over the long weekend. So what's coming up on the agenda for Bronze? It's all COVID related, and it's getting back to our normal business. So we'll be talking this week about what the standard operation procedure will look like for swabbing residents' parents, if at all. We want to look at how we get volunteers back in to the hospital and students for work experience. So that will also be on our agenda. And then we'd also really like to look at how we get our playrooms back open and also our coffee rooms. So that's kind of 3 big pieces to work up for us this week, and to pass them through the trust-wide approval process to ensure that they're happy for all of those things to go ahead. So I'll take you through then onto the operational pressures for the week ahead. So as I just reflected at the start, thank you to everybody that worked over the long weekend. It was really busy for us within the Children's Hospital. We've got a number of our surge beds open in our inpatient wards. We have seen a slight increase in RSV again, but this is looks like it's just taken a slightly downward trend this morning. So we'll just keep our eye on that and feeding that into the national picture that we can feed those kind of anomalies into. We know that Crit Care, we've come into a really pressured position across Crit Care, so priority today is really about just getting some flow in through there and getting our step downs out to the ward areas. And we're also still engaged in our national instant response to the acute hepatitis, so obviously being one of the 3 centres. We're continuing to have a 3 times a week meeting with NHS England, just reporting against what we're seeing for us regionally. And then just to touch on as well, we've come in this morning to the RSV point of care testing cartridges not being available. So I've just spoken to the Bronze Commander for Pathology this morning. They're currently trying to get some mutual aid regionally to get some point of care RSV cartridges across to us. In the interim, what they've said is if you put a yellow or a red post-it note in with your PCR swab, that they will expedite that through the lab, and it'll be about a 6-hour turnaround time. It just causes us some problems in terms of how we place patients while we're waiting for that result to come back. So we're just working through that, but they're hopeful that they'll get something to us by this afternoon. So I'll keep everybody updated on that as we go through the day. Thanks, Colin.
Thank you, Laura. And I was just going to highlight our financial position at the moment is still green, and that is because some of the great work that has been done around our waste reduction program, essentially here in the Children's Hospital, which Liz will come and highlight one point of it. But it was just to re-emphasise that does allow us to essentially look at providing and improving our service here in an easier way, and the regulations around that, certainly within LTHT, are much easier for us to do as a TRI and deputy TRI team and management team as well. And that's allowed us to do some amazing things over the last year. Some of the clinical teams that we put in, some of the positions that we've recruited to have been great. So thank you for all your engagement with that. And I think, Liz, it's over to you to highlight one of those schemes just now.
Thanks, Colin. Morning, everyone. Today I'd like to share a really nice little example of waste reduction that was identified and implemented by one of our database managers. So we've got a support and maintenance contract with external providers for one of our specialised IT systems, and it was due for its annual renewal. And it's an essential contract for us, so it absolutely needed renewing. But fortunately, prior to its renewal, our database manager reviewed the tech support element of the contract, and she concluded that we actually didn't need as much support as was built into the contract, and we certainly hadn't drawn down on it in the last year. So she renegotiated the contract, reduced the number of hours support in the contract to more aligned with what we anticipate requiring, and the result was we're saving £3,900 a year, so really nicely done. So I suppose just my additional message is, if any of you think there might be similar opportunities within your services, please let us know. Thank you.
Thank you, Liz. And that's a really nice point, that actually it's all teams and all members of all teams as well that can get engaged with it. So huge thanks for that. And not every penny is pounds, and thousands of pounds are looked after as well. So that's brilliant. So thank you. We have now got the great news to share with you all, if you've not already seen, that one of our clinicians within the Children's Hospital got awarded an OBE in the Queen's Honours List, and that is Dr. Fiona Campbell, one of our diabetes paediatricians based across at St James's, for recognition of her amazing work that she has done with children and young people with diabetes. And That was also alongside two other people. Julian Hartley, our chief exec, was knighted, as well as Chris Claytor, our associate director of supplies and procurement, also was given the honour of an MBE. I did have the chance to catch up with Fiona over text being away and things, and the things that she wants to highlight was the great work that, in theory, this isn't an award for her, it's for the team, and she the diabetes team do an incredible job of serving not only the sort of Leeds, West Yorkshire, but also some national patients, given their excellence in their service that they deliver. Some of the relative work that they've done with the patient engagement, so their DigiBeat digital platform, both from an educational point of view, as well as ongoing sort of skilling up families and patients with the condition to treat it, is just incredible. So, you know, I couldn't be prouder of Fiona and the team as a whole, and great to see the recognition of that. So well done to all of them. Laura, I believe you're also going to give us an update. We had the privilege of Professor Simon Kenny coming to visit us as well recently.
We did. So for those of you that don't know, Professor Simon Kenny is the National Clinical Director for Paediatrics within NHSE, and he visited the Children's Hospital just the week before the Jubilee celebrations. And he's been leading, or one of the key players that's been leading the national response to the acute hepatitis event. So essentially he wanted to come and visit Leeds as one of the 3 centres, and so he went up and met some of the clinical teams and spoke to a patient who'd received, and the family who'd received a liver transplant as a result of that. And it also gave us an opportunity, so myself, Colin and Mike Richards, just to hear about some of the stuff that's happening nationally for children out of NHSE, and some of the different sort of funding opportunities and activities that are coming online soon. So it was a really great visit, great recognition of the wonderful work of the liver team, and also Quick Care, who have also been involved in terms of managing those children post transplant. So it was a great visit.
It was really proud to see all the clinical teams. He's speaking very highly of us here within Leeds, as rightly he should be. And interestingly, as you say, the chance that we had to sit down and discuss him in his role as clinical director for children and young people within NHSE, one of the points that he wanted to pick up on was obesity, and was around the Q clinics that are going to happen. And Paul, I don't know if you are there. I know there is a launch event very shortly due to happen, and I think it's this month on the 15th, if I'm correct, but I could be wrong about the exact date. Paul, are you there?
Yes, I'm on for any other business, but I can take it now if you want me to.
That is perfect. So I'm gonna step you up, and you've stepped up to the plate anyway brilliantly. So thank you, Paul. I don't know if you wanted to highlight your launch event that's due to happen for the service.
Yeah, sure. So the Q service complications relating to excess weight, we were awarded funding from NHSE as one of 15 sites across England. A lot of work, blood, sweat and tears has gone into setting up a brand new service from scratch, along with Dr. Caroline Steele, and we're really excited to get going with our MDT team that are all newly recruited in 2 weeks' time. And we've got a launch event on the 15th of this month, which is next Wednesday, I believe, and that should be sent out as a Eventbrite link. It's free. It's running from approx 10 till 4. The main Q information will be delivered between 12 and 2, sort of what the service is going to look like, how to make a referral. But there's bits in the morning on genetics, safeguarding, respiratory, and then some stuff on the afternoon with regards to stigma, using the correct language, and some of our patients coming along to talk. But so you can dip in and out. It's one link. The main part will be between 12 and 2 for those that want more information on the referral process. Thank you.
Thank you, Paul. And that does bring us on to any other business and anything else people want to highlight. I am just having a little look in the chat. I don't think there are any questions there at the moment. Ed is shaking his head away. So in that case, we will obviously put the link in with regards to the Q launch event, and as Paul's highlighted, the 12 to 2 would be good, and I wasn't aware as well, so I'll try and attend certainly part of that day if I can do so. Great work on that front, and lovely to think as well of some of our clinical clinicians, but also the team as well as a wider whole being recognised nationally with regard to the awards. So well done all. Hope you have a good week ahead, and I look forward to seeing you all soon. Thanks all.
Thanks, Colin.
Bye everyone.